Hello guys, good morning everyone, good afternoon, good evening. Hope you're doing fine. Msauma here once again. First of all, allow me thank all my subscribers for having subscribed and taken your time to watch my videos, sharing them, liking and commenting. Thank you very much. That's the love you can show me, guys. And I would love to urge whoever that this is your first time to view my channel or to view my videos on my channel, that please subscribe to my channel, like my videos, share with your friends and comment.
Cervical cancer is a malignant tumor of the cervix. Most cases of this cancer are caused with an infection of the human papillomavirus. Signs and symptoms of cervical cancer: pain during sex, unusual vaginal discharges, and in most cases, these discharges are offensive. Menstrual disorders is another sign and symptom of cervical cancer. Here, you can have changes in your menstruation period, as in you can bleed before even your expected date, or you can bleed twice or even thrice between your menses. Vaginal bleeding during sexual intercourse is also another sign and symptom. Other signs and symptoms, these are the signs and symptoms that can present after the further spread of this cancer. Symptom number 1 is pelvic pain. You can have the pain in your pelvic region. We have nausea. Nausea is a feeling of vomiting. You can have kidney failure. Kidney failure is a condition where the kidney fails to function normally as it's supposed to function. Loss of weight. Here, a person loses weight unknowingly. We have fatigue. Another symptom is bone pains. You can start feeling the pain in your bones. Remember, cancer can spread to any part of the body. You can also lose appetite when you have cervical cancer. We have what we call risk factors or predisposing factors to cervical cancer. Point number 1 is having multiple sexual partners. Point number 2 is starting to have sex before the age of menstruation. Point number 3, we have prolonged use of birth control pills. We also have what we call cigarette smoking as a risk factor to cervical carcinoma. Untreated sexually transmitted diseases is also another risk factor to cervical carcinoma. We have another thing to look at as the examination and diagnosis to cervical carcinoma, things that are done to come to a ruling that this is cervical cancer. Papa Nikolai test, other people call it pap smear. A pap smear is part of the woman's regular pelvic examination. Your doctor collects cells from the surface of the cervix and then taken to the technician to be looked at under a microscope. If any abnormality is spotted, your doctor will take out a bit of cervical tissue for a biopsy. Remember, a biopsy is a procedure whereby a tissue is taken from any body part for laboratory checkups. Another test that can be done to come to a ruling that this is cervical cancer is what we call a colposcopy. This is like the other pelvic examinations that a lady can do. Your doctor may use it if a pap smear finds unusual cells in your cervix. They stain your cervix with a harmless dye so the cells are easily seen. We can also look at the treatment that can be given to someone having cervical cancer. The first treatment that I have here to present to you is what we call surgery. A surgical procedure is carried out to scoop or to remove your cervix, that you are left without a cervix. We have what we call radiation therapy. Radiation therapy, here your doctor puts a radioactive material into your cervix, and this material puts cancer-killing rays close to the tumor while sparing the other most healthy tissue around it. Another treatment that can be given to a person with cervical cancer is what we call chemotherapy. Chemotherapy, powerful drugs or strong drugs are used to kill the cancer cells in advanced stages. Preventive measures, or how we can prevent, or how can a lady prevent herself from getting cervical cancer. Get a pap smear. Getting a pap smear test every 3 years when one has clocked 21 years or the age of menstruation. An HPV test or a human papillomavirus test is carried out when a person clocks 30 to 65 years after every at least 2 years to 5 years. Sexually transmitted diseases tests are carried out in those who are usually sexually active. Thank you for listening. For today, Musau Mahi presented this. Thank you. And for whoever has not yet subscribed to my channel, please subscribe for more healthy issues and entertainment things on my channel.